I have now the privilege of introducing our first keynote speaker for the session, Dr. Nima Asgari, Director, Asia Pacific Observatory of Health Systems Policies, World Health Organization. Dr. Asgari has been a public health leader across diverse economies since 2000, steering APO's research agenda and fostering collaborative capacity building. He directs initiatives vital for robust health systems. With a wealth of international experience, including roles in Cambodia, China, UK, Dr. Asgari's commitment to global health is underpinned by a medical degree from the University of Edinburgh and a master's from the London School of Hygiene and Tropical Medicine. Dr. Asgari comes from Iran, where my most favorite carpets are. So, without much ado, Dr. Asgari, may I ask you to come and give us the keynote address for this morning? Thank you.
Thank you. No, that's it. Good morning, and thank you. It's either carpets or cats.
So, would you want a hand mic just in case this is not tall enough for you?
Can you hear me? That's okay. Okay, thank you very much, and good morning, everybody. It's a pleasure to be here, and thank you to the Access Health and Rockefeller for inviting APO here. As mentioned, my name is Nima Asgari. I'm the director of the APO. I'm going to talk a little bit about how and the role of the regional observatories are and how we are evolving as part of the assessment of the health system. And I put that assessment in a very broad apostrophes. A lot of the conversation here has been on assessment of specific areas. And what we do much more is look at the whole system as a whole. APO is one of 3 observatories. There is the European Observatory, if you like, the oldest, the most established one. We got established about 10, 12 years ago. And a few years ago, there was African Health Observatory created, which covers sub-Saharan Africa. A little bit about APO, because some of you work with us. I know quite a few of the people here, but some don't. And I want to give a little bit of a background and then how we are evolving. We were established in 2012. We are hosted by WHO, which is why I'm telling to Sohail, kind of WHO, but not quite. We cover both WHO, WIPRA, and Zero countries, so about 40-odd countries. And we are a partnership of governments, WHO institutions, WHO kind of the banks, whenever they manage to give us some funding, and academic and policy institutions across Asia Pacific. Okay, what we do is primarily about characterization of the health system. We do that through our health system reviews, which are the HITs. And as part of that, we try to identify pressing health systems issues across the Asia Pacific and either develop policy briefs around those issues or we do primary academic research looking at comparative analysis of those work. We are moving more and more towards knowledge brokering, and I'll talk about that later on. And also, unlike other observatories, we are very much focusing on capacity building by doing. So a lot of our work is now being done in the countries by twinning and linking institutions with other institutions to support each other. Our primary audience group is wide. It includes within the Ministry of Health, it includes outside of the Ministry of Health, other institutions, development partners, and their consultants, as well as what we would like to call policy entrepreneurs, policy champions, who can try to provide our messages through the civil society or directly to the government, of course, academics, and we're trying to be more engaged with ASEANS and the Pacific community as primary political organizations which are functioning in the region. As I mentioned, we produce a host of different publications. Our flagship product is the Country Health System Reviews. And they have, they're detailed, and I'm going to talk about those in particular moving forward because that is the part of the assessment conversation. They look at the whole system, and in that sense, they're quite unique. We've got about 21 countries done in the Asia Pacific, and we try to update them to keep them up to date. And they are based on a template, so we're trying to do the same thing across countries to allow easier comparison. Our comparative country studies, and I think this was one of the last one which we published, which was looking at the public financing, private providers of health and how the regulation works for those countries, comparing Philippines, Thailand, and Japan as 3 countries in the region. They tend to be original research. We also have policy briefs, which look at a specific area which is applicable to the multiple countries in the region. And this one that I put in here is about digital health and UHC. Specifically for the Pacific Island countries, which we know have a major challenge in that sense. And then as part of COVID, we did some COVID-19 health system response monitor analysis, which was country-focused, but went into looking at the wider, not just the health per se, but much more about the wider government response. We support journal publications, and we will be running more and more webinars and policy dialogue as part of our work. Where are we? So evolution, and I want to talk a little bit about this because this is where we are moving to, and I think has some bearing in today's and yesterday's meeting. We are looking at 2 ways of updating ourselves to keep up to date. The way that we review the health systems as part of the advocacy tool, as part of the capacity building, and then changing how we function, moving from academic-led organizations to a commissioning work of where we are trying to get what the policymakers are asking for and trying to get the correct academic grouping for that and becoming much more of a knowledge broker and creating networks of policymakers and academics in the region. I'm going to talk about HITs. For those who don't know, a HIT is becoming more and more voluminous, but originally it is a comprehensive analysis of the country, which starts from the context, from social and political economic context of the country, going through the health system organizations, financing, human capital resource, service provision, and then reforms and assessment. And it's fundamentally, if you look at that, the first 6 chapters are description. It describes the health system. And then we are looking at an assessment of the system. So instead of looking at specific areas, it tries to look at the whole thing. And it means that the assessment part is not as detailed, it cannot be, as a specific assessments which are being done, being the PHC, being the IHR assessment, being the digital health assessment which is being done. So it is meant to bring some of those things together. And I say that because as we are moving and revolving, we see that there are certain things which we need to bring out. So talking to what you are saying, we are now including inclusivity and gender equity issues as part of the describing. So trying to bring that out, not necessarily to show, oh, this country is good or bad, but it's much more about an advocacy, because by working with the ministries and saying that this is what we need to bring in, it brings it on the top of their thinking to try and get that much more involved. Same thing when it comes to climate change and health sector preparedness. How can we don't want to do an assessment of that, but we want to describe roughly where they are. Again, it's about building that advocacy by doing it. A lot of the reviews that we do are a collaboration of the academics in the country and the government staff in the country. So it's that collaboration which we also try to build in the capacity as doing that. And this is much more part of the evolution, moving away from originally hiring consultants to do the work to actually getting much more involved with the government and the academics in the country, with external editorial and external mentoring to trying to bring that up. One Health and AMR are other areas which we are looking at trying to, again, bring that up. AMR is such a wide and all-encompassing thing that it's difficult to say which bit of AMR we are looking at. And for us, the critical factor is the coordination across the agencies. So in part of that is, as under One Health, how is that being done? Who owns the AMR process? Not just the health sector, but also through the environment, the animal husbandry, et cetera, and how is that collaboration is being done. We looking at the long-term care as another area which we are emphasizing, because in Asia-Pacific that is becoming an issue. Even in India, we're doing work, for example, in Tamil Nadu, which are genuinely worried about long-term care because of the aging profile changes within the actual the country. And as expected, we are seeing a shift in service delivery to looking at much more on the primary healthcare and actually bringing that up as a way of things are being done. We kind of moved away from, the classical thing is you look at human resources and you look at capital resources and trying to see how many beds you have and everything like that. And we are moving away from that. We want to look at the enabling functions. And by doing that, we're actually including digitalization as part of that, to actually say that digitalization, health information, regulation are as important as HRH and number of beds and hospitals that you have, because they're all part of the enablers of the functioning health system. So let's group them together and look at them as a one mass together. And that's it. And in the assessment part, and this is, again, comes back to the conversation, a lot of the assessment is focusing on equity and financing issue, which I think is one of the areas where not much else gets done when you look at the whole health system review. We actually bring that in, and we've always done that. On purpose, we've putting health system resilience assessment as part of that conversation. Again, if you look at the work which is being done by HQ, they have books upon books on health system assessment, on health system resilience assessments, and a HIT cannot do all of that. Otherwise, we just call them the health system assessment or health system resilience assessment. So it's about bringing out the most prominent parts of those and putting this in the conversation so that you can look at the whole thing and gives a taste of where we are. Now, this is more or less on the way that we are moving forward when it comes to our flagship products. But we're also looking at form and function and how we as an organization are evolving. As I said, we want to move much more into the networks, looking at questions which are raised by policymakers. And let me give an example of what we did, for example. Back in, towards the end of last year in WHO Zero, there is a PHC forum. And what we did was they asked us to lead the research aspect of this conversation. And what we did is that we actually went and said, okay, let's look at who is doing what when it comes to PHC research in the region. Distill those to actual questions, distill those to actual institutions who are focusing on specific aspects of primary healthcare, and then start having that as a starting point for a conversation with the policymakers who are coming to this forum to say, what is it that you guys want to do now? This is what's being done. And by linking these two together, we are able to identify the actual work that they want to do and then move that forward to, because we now know who's doing what, to identifying the regional experts who can actually then support the process. And that's the angle that we want to move much more about commissioning work that is required. And as linking with that, what we see is that the beauty of a HIT, if it's done well involving the country, is that it identifies questions. And those questions are ripe for developing very specific policy briefs, which is for the country. Maldives has a challenge when it comes to use of or misuse of drugs. So how do we actually then try to identify a brief which tries to tackle that? Whatever is that question which comes up. Fiji might be talking about digitalization and challenges that specifically is unique for Fiji, which they want to overcome. And this allows us to do that. Hong Kong is asking about health financing. How can we actually maximize that? And those are the questions with the HITS provide, and because we are developing this close collaboration with the government, with the academics locally, we are able to then bring the regional global input into that conversation. And I say that again, and I'm going to put my WHO hat, that it is a very, very challenging balancing act that APO does as a partnership versus WHO does as a body within the region which provides technical support to countries, and where do we sit and versus them, and to make sure that we actually work collaboratively and synergistically with each other, as opposed to competing with each other. And as I said, we are looking much more on expanding those partners that we want to work with, including organizations, so that we can actually then work much better as a collaborator of knowledge and evidence generator, as well as a broker. I think that was the last slide. Thank you. You can find everything that we have on our website. If you are interested, you can download all of our publications. I want to finish there. On purpose, I want to talk a bit more about I didn't want to go too much on the resilience side, because I wanted to talk about how does this work as somebody who's been doing this for 10, 12 years in the region, developing these health system reviews. How can we then evolve and match what we do to what's happening on the very specific technical areas, and how can we actually collaborate on some of those thinking to bring them into our own way of doing work. But thank you very much. I'll finish on that.